I think she's here now, Lee.
Okay.
More than shortly.
That's exciting.
Oh, there she is.
Cool.
We're just getting back into screen. Hey guys, so we're gonna start here in just a couple moments. And today we're talking about fun stuff. Originally we were gonna be closer to February 14th. So to us, it's all about love and support and kindness and all those wonderful things that are what we're about. And so we'll probably take a little bit of time to talk about that love and kindness side and the support and how important that is. And also compression, because that's what we're about. Like a hug, for sure. So I think, guys, let's go ahead and start. We're 2 minutes in, but we have people joining. If you have questions, please put them in chat. We have Paula with us with the blurred screen there. That's Paula. And she'll be taking your questions. And if we don't get to them because this half hour goes so fast, she will definitely reach out. And we're really excited to have you here tonight. So with that, we're going to go ahead and start. Welcome to our Prairie Circle chat. We're here to bring our communities together with education and support. And thank you all for being here tonight. We have Mindy with us and Toni, Dr. Toni Storm. I am Holly Markwald, CEO here at Prairie. And I'd like to take a minute to have Mindy and Toni introduce themselves to you. Mindy.
All right. Well, hello, everybody. Thank you for joining. I'm in Central Time, so this is 8:30 p.m. So no matter what time it is where you are, thank you for taking time out to show up here and support us. I'm Mindy. I was diagnosed in 2016 with a stage 2 breast cancer. No notable family history, no genetic mutations that would increase my likeliness for developing breast cancer. So I was a competitive runner whenever I was first diagnosed. So compression, sports bras, that was kind of my thing. And just a little anecdote, like since finding Prairie, since, we became friends, it's been amazing. It's been a relief to find, as I've gotten back into sport and activity, like a bra that just really supports me with my post-reconstruction asymmetry. I had done chemotherapy, radiation, and multiple reconstructive surgeries, but due to radiation tissue damage, I had to go back for a couple other reconstructive surgeries. And so I wound up with quite a bit of asymmetry. So compression and support are right up my alley. But as of February 12th, that was 7 years since my diagnosis with breast cancer. So I'm doing well, kind of living life in the aftermath, and yeah, just really honored to be here and
Awesome.
Celebrating survivorship.
Thank you, Mindy. Hey, Toni, I can see you there.
So, Mindy, that's an incredible story. I'm excited to ask you more questions about that. So my name is Toni Storm. I'm a surgical oncologist, and I specialize in breast cancer surgery. And my goal is to help women feel good about themselves, look as good as they can, so when they get out of the shower, they're not reminded that they had breast cancer, that it doesn't define them. And I use every weapon available to me to do that. And the Hugger Prairie products are a important part of that for me and my patients.
Awesome.
They love it.
And for those of you that might not know, Toni was really a key factor in our learning and integral to learning how patients need compression, but also how the surgeons need compression post-surgically, and trying to marry those two with comfort and support. And so Toni was a part of that journey with Prairie and helped us really understand what does compression do for the body. And so I think with that, as our topic today is communities of support and compression, where can we start? I think one that we hear the most often are, what are the benefits of compression post-surgery? So if we start there, that can take us on a journey to get to also the support side. And that question would be for you, Toni.
So support is really key. You think about any time you're going to have swelling. What do you do if you have swelling in your feet or your ankles? You put them up. You put a compression sock on. So when it comes to the chest and the breast, that's more difficult. because we can't just elevate them the same way. So having a garment that does a couple of really key things. One, literally hugs the breast, supports the breast, holds the breast, and gives that compression, but also does it seamlessly where there aren't a bunch of literal physical blockages to that flow, seams that would stop things from being able to move into the other basins of our body that naturally are going to help us deal with that swelling or edema that we like to call it. It's also really important in that it gives people comfort. Keeping the breasts more still in that post-surgical time also helps with healing and cosmetics. So there's a lot of benefits, and they're physical and they're also psychological. I have women come in and tell me, and Mindy, you can comment on this, they literally will tell me that they feel more comfortable when they're wearing it. And when they first take it off, it's the first time they notice tenderness. They'll say they really didn't feel that before. And they like how it makes them feel hugged, which I love it when they say that.
Yes.
It really does. So, you know, my comment to that too is I even questioned, you know, the very first time I put one of the hugger bras on, I thought, this does not feel like my normal experience. Like, is this right for me? Because I am so accustomed to having elastics digging in all the uncomfortable places. So in the best way, like there was, you know, it was like an immediate adaptation, and I really had to take off and start running to appreciate that. Because at first I doubted, like, you know, is this going to support me? But it hugs you so gently and compresses you so gently. Like the hug is the perfect analogy for that. And, you know, I run hills a lot of times and, you know, kind of go off road whenever I need to. And it's like, you know, there are times when things otherwise would be moving around, but with that like perfect degree of compression, that like gentle compression, it's amazing how still it can hold you. It's been really fun to, you know, have that experience in comfort.
It's really important
again.
because as surgeons, Dr. Alan Gabriel and I were met with Holly and Rocky when we first started really talking about this, and then expanded into the rest of the team, is about what we feel is so important as surgeons to offer the patient. So I think this garment is very special in that it's not just a garment that has been made and designed to hold things still. It's a garment that's been made and designed to meet what we see are the surgical needs by people who specialize in the kinetics of the breast, movement of the breast. Then it's also brought in people who are excellent at being able to bring design as part of it. But there's things like laying flat on the operating table, the fact that you can adjust the strap height and how tight that is, the fact that the garment actually goes higher into the armpit or the axilla because we often operate up in there. And so all of these things are, I think, really special about the garment.
And I want to circle back around. So we talk about huggers a lot because that's what we do, but really this is also about education on any compression. And it's really whatever you find that works for you, that's the magic. You know, we're here to educate, and if it's a hugger, awesome, we love it. And if you find something else, awesome, definitely let us know what you find and what you love. And I wanted to share, when you mentioned the psychological part of compression post-surgery, I had a gynecological surgery, and one of the things, and I'd never been in the hospital before, I'd never experienced that before. This was in 2020, so it was like completely new, and I was really nervous. I was really uncomfortable. You're so vulnerable, the gowns, the whatevers, you know, all the things happening. And at one point I woke up, it was like 2 a.m, and I just wanted to put my hugger on. Like, you know, that's all I wanted. And I had this IV pole, and the charge nurse was the sweetest woman ever. And she just came in and she helped me put a Vita on. And I felt instantly better, for real. I just felt like I was more comfortable. I was more confident. I was able to get back to sleep. And it was just because I had something that I felt secure in. You know, I just felt secure and less vulnerable and more comfortable. And that to me was pretty impactful. And also with the IV pulls and then all the stuff going, how else would you put on a bra? And I can see why they say don't wear your bra, you know, the nurses, but it's like you haven't met a bra that's made to work with someone who's in surgery then. Because yes, you can wear a bra and it's not going to mess with all your stuff, you know? And I just really what it said to me is this helps me feel better. You know, I just feel better. And I haven't shared that ever before, but I'm sharing that because the psychological impact to me was just as much as the physical aspect of being secure. It helped me be more restful and more comfortable and definitely more confident leaving the hospital because I just slept in it, of course. Um, and, you know, kept it on from that point on. And I just thought that's a psychological piece that I didn't personally understand until that moment. Yeah.
There's a ton with what we call ERAS, and that is enhanced recovery after surgery. And what we're really starting to appreciate is the mind-body connection and some of the amazingness about the body and the nervous system, and the fact that the more chill you go in, the more chill you come out, and the more you can feel supported, the bigger difference that makes in terms of how you recover, how much pain you have. The fact that anxiety and different things are actually linked to pain. If you're anxious, you will have more pain. And so these things are very real. Mindy, what do you think about your experience?
You know, I would say these it's all making sense too, because, you know, as someone who deals with anxiety myself, you know, I know that when I enter a situation like a surgery already tense, you know, when I recover, when I'm out and trying to deal with pain management, you know, I can't be tense like that. That will just continue to add to my pain. You know, I couldn't agree more with what you're describing. And, you know, even just that general state of comfort, you know, when you are not tense, when you are able to relax and feel confident, you know, just like Holly was sharing, you know, and as you're alluding to, you know, you can heal and recover better. You can have better quality rest.
Mm-hmm.
It all makes sense.
And I think one of the things that I do hear a lot in terms of compression is the concern that it's going to be uncomfortable and I don't want to have to wear it 24/7. And one of the things I think, Toni, that you probably challenge us on because you're such an advocate for patients is I want something that our patients can wear 24/7. You know, they can fall asleep in it. They can wear it during those key recovery times and not have to take it off, especially that 3 to 5 days post-surgery. You know, it makes such a difference. And that was quite the challenge. And I still hear, we still get a lot of, do I have to wear it 24/7? No, you don't have to. And then they do, you know, they wear it anyway because it feels better. But what is, and we always, I'll put the disclaimer out now. We always say, please talk to your medical professional for any questions you have specific to compression. But kind of generally, when we get the question, should I wear compression 24/7? What would you answer to that, Toni?
So for my patients, I send them home with the garment on. We put it on actually the table before they even come in the room. And then we put these operative pads, they're called chuck pads, over the top of them. And so when they're waking up, we actually put the nurses put the garment on the patient and they go home with it. I have them wear it for 2 weeks. I don't do 5 days, I do 2 weeks. Because I know it really makes a difference. I tell patients that if they want to wash it, take it off and wash it. And I rarely have anybody who isn't extremely happy with it. If I occasionally have somebody who feels that it's hot in terms of the material, I will tell them that they can put sorry.
The fun fleece is out.
They can put on a t-shirt underneath or a cami, hush it, if they want. And I find that there's just pretty much nobody who isn't happy if I give them that option. So people love it.
Mhm.
And like I said, I'm 2 weeks. I
Yeah.
have teenagers, the world of the internet. I just want to let you know I have teenagers here, and that's what's happening in the background.
Teenagers, dogs, life happens.
Yes.
Yeah. And I think in terms of that 24/7, and Mindy, you've been through different recovery times, and also as a runner, there's recovery. And what we know with recovery, regardless of what that's from, compression makes a difference. You know, you look at athletes, and now you watch the NBA, they have their full compression, like knees and socks and elbows. And I think, why are we not thinking about that for surgery, right? Why do we not embrace that? It's really interesting. It's a different connection, but you're putting your body through that trauma and you need that recovery. I'm not speaking as a scientist. It just is anecdotally, I think, if professional athletes want to wear compression for recovery, maybe we can too. Yeah. And again, my personal experience has been really positive with that. And on the psychological side, and then for recovery in terms of athletics, I have to say, I'm 100% biased for huggers for sure, but it does make a difference having a good bra when you're exercising for confidence, but also for recovery, I think.
And specifically with the hugger, for me, you know, I referenced my asymmetry. I had a unilateral mastectomy. So I have a natural breast with a small implant to help with symmetry, but also a reconstructed side that has since, you know, with a follow-up reconstructive surgery, had to go smaller just because of tissue damage and the like. But I have different support needs for both sides. So, you know, specifically with the hugger, being able to adjust that while still having that, you know, gentle compression really makes a difference for me too. And I leave my bra on since they're anti-stink. I can do this. But I leave them on for quite a while, you know, after exercising, and it's still comfortable. And I feel like there is a role to that in recovery because, you know, with my still having the natural breast side, you know, I don't want to lose gravity any faster than I absolutely have to. So just another little add-in on why I like the compression.
I think it's that, you know, you think about the weight blankets, the weighted blankets, which is something that helps a lot of people with anxiety, kids, adults. I think that the hugger post-operatively is almost lending that kind of a feeling.
Absolutely.
Also, just one little 5-second shout out because I can't help myself. Mindy mentioned that she had no family history. I just want anyone who's chiming in and watching us on Instagram to realize that breast cancers, the vast majority are sporadic. They just happen at about 85%. So not having a family history is not protective. Having a family history increases your risk. So breast cancers, 1 in 9 across the nation, 1 in 8 in the Pacific Northwest, 1 in 6 if you count the earliest form of the disease, DCIS or precancer, stage 0 cancer. So women, get out there, do your imaging, do your self-breast exams. Understand this because breast cancer is common. 1 in 4 people will be diagnosed with breast cancer in their lifetime. If you're a woman, half of those are breast. So, and catching it early makes so much difference. There's so much we can do. We are getting so much better at treating this disease, and we are getting better all the time at breast conservation. We're getting better at breast reconstruction. There are many options. So,
thank you, Toni. It's a good reminder. It's a good shout out for education to everyone here watching. That's what we're about.
That's such powerful information, and it just needs to be shouted from the rooftops, you know. Needs
Absolutely.
This education.
Thank you, Toni.
oh,
And
you're welcome.
I think in terms of support system and what we're talking about with compression, one of the questions that we were looking at earlier in terms of communities of support, and Mindy, this one's to you. How has having a support system helped your recovery and continued recovery? And you had a really big milestone just, you know, last week. So how has your support system?
Well, you know, first I have to say, you know, I am aware that not everybody has access to great care and not everybody has access to a robust, you know, personal support system. And when I was diagnosed, it was back in 2016, early in the year. And, you know, the Instagram community of, you know, breast cancer, you know, thrivers and survivors had not yet been established. It wasn't a thing. So, you know, I was with my local community like pretty much the first 2 years. And you know, it was everything for me. You know, it helped me with my anxiety to such an amazing extent, in that I didn't have to fear for, you know, being alone. I felt like having that support around me, knowing that people were always there, like they wouldn't let me fail, even if I was, you know, kind of waxing and waning in my own, you know, spirit. You know, there were people to lift me up. And so, you know, it's just been very humbling. And I know that not everybody has that. So it means even more to me. But in the years since, you know, it was probably more into like 2019, whenever I started to share my story on Instagram and social media. And, you know, the survivorship years can, you know, especially as you bridge into long-term survivorship, can almost, you know, it's just a completely different bear in terms of how challenging, like mentally and psychologically it is, because, you know, I've had my fertility, my future, you know, completely altered. So, you know, having that support community now through the social media world too has just been such a gift and a blessing, you know, to not feel alone, to know that there are other young women out there who've been through what I have, who are in, you know, similar seasons. And it's really, really comforting to know that I'm not alone, and, you know, to try to reciprocate that support as best I can.
I just want to chime in for a second, because I think that's super powerful. One of the things I see, and Mindy, you can speak to this as well, is when someone's initially diagnosed, there's usually a lot of support from friends and family. And what is one of the realities that's very difficult about this disease is that once you're touched, you're always touched a little bit. It's never wholly over. And family and people who really love you, whether they mean to or not, they want it to be over. And you go through so much action, so much treatment. And if you're somebody like Mindy and you have chemo and then surgery and then radiation and then more surgery, and then all of a sudden everything stops, and people who haven't been through it are like, okay, well, it's over now. And you made a comment about the survival years are a whole nother bear. This is a really big thing I see a lot with people, and I love that you're addressing it. I really want people to be able to see that, because I find that there's a really hard kind of up and down, you know, that you hit. Now, I have had cancer, but it wasn't breast. And I want you to speak to, because I have not been through what you've been through, but I've watched a lot of you, and you guys teach me and you tell me, pay attention. So what you're talking about in terms of that support, in my opinion, is huge.
It feels huge. And, you know, just to kind of piggyback off of what you're saying, something that I have found, you know, in the years that follow, like after active treatment, after, you know, surgeries and those recoveries were over, I found that it's invaluable for me, you know, to put a volitional effort into communicating with my coworkers, my family, my friends, like where I'm at, because they, you know, when they believe that it's over and done, you know, that comes many times from a good space. And so I've really tried to lean into my role and the importance of the communication that I'm providing them with how I'm doing, how I'm feeling, what I need. I think that's a really, really important piece too, that we, you know, find that comfort in communicating with those around us. Because they wouldn't know if we didn't tell them.
That is, you are so smart and so right on. One of the big things with anybody who goes through cancer is we think we're informing the people around us, but we're often not, and they need updates, especially kids, people with younger children. you don't have to get into details, but you do need to update them because they may not feel that they can ask, and they may not know what to do or what their role is. And that can be also, you know, significant others, coworkers, friends. I think what you just said about leaning into them, letting them know, being aware that you need to let them know, and not being afraid that that means you're weak. Or the flip side of it, they ought to know. Because you know what? They're not going to know. We can all be thick sometimes. Tell.
They haven't been.
Yeah.
You know, when they haven't been there, I can't expect them, you know, to just know intuitively. So yeah, I agree totally.
So good. She's smart.
Yeah. I
Thank you.
the social media thing is obviously new to me, and having to be on social media has been an effort, but a really beautiful one, in that Prairie is 100% dedicated to education and bringing communities of support. And this is why. So these moments of being able to share this with these really wonderful humans here that we have with us tonight, and also this reverberates over time when people are looking at this on a recording. And you never know when this moment is going to change someone's life, where this is so impactful and so important. And every talk we've had people reach out with these private moments of, this really has changed my life. This information empowered me to make this choice for myself, or to feel validated. It's okay to feel this way. Other people feel this way. Or, hey, this happened to them. Or this is a resource that I have. And this is the reason why I come onto social media with these great folks, is so that we can bring this message. And thank you so much also for our support teams out there. We all have them. Toni, I use my boob cup just for you. It's hearts. Those of you who don't know, I love hearts. And my dear friend Dawn got me a Hug or Love cup, custom made, with boobs and hearts. And that's somebody who knows me to my core. So our support teams, you know, they do wonderful, wonderful things for us. And thanks for allowing us to be a part of your night tonight, guys. And I saw lots of questions in the chats. I don't think we got to any of them, so we will reach out to everybody. And definitely, you can also send us some email to yoursupport@prairieware.com. And these guys, these two wonderful humans, are tagged on our Insta Live if you want to reach out. And guys, that's a half hour already. Flew.
That flew by.
Yeah, it so flew. Mindy, you're such a joy. And also, we didn't even get to talk about Mindy's home life, in terms of, she is a ranch girl, and I love this. I love this so much. Yeah. So something we have in common.
Thank you. It's been a fun part, you know. How can you be upset when you have a bunch of little lambs running around you, jumping and playing? You know, it's good for you.
Yeah. All right, guys. Thank you so much for tonight. Thank you, Prairie Wear community and Prairie Circle. Wishing you a great week. Thanks so much.
Thank you.
Night.
Thank you, guys.